begin.
Minister, a failure to plan and a failure of leadership left patients and left frontline healthcare workers high and dry during the winter period. And in fact, the pressures that those on the front line are facing today are still as stark as they were in the first week in January. And it has to be said that the experience of patients in emergency departments, the length and breadth of our country, with overcrowding levels that we haven't seen before, was an absolute disgrace. I will be the first to accept, Minister, that rising cases of flu, COVID, respiratory illnesses, of course, would place pressures on the healthcare system, and did. But we cannot excuse the lack of capacity that we have in our hospitals. We cannot excuse the fact that the winter plan was clearly insufficient. And we cannot excuse the fact that there was not sufficient leadership coming from the centre, either politically or from the HSE leadership, to ensure that patients were treated with dignity, that we had humane treatment of patients as opposed to the inhumane treatment that so many people had, and that we had a health service that could offer the very basic levels of care to patients. We all saw the images of trolleys in corridors in hospitals, the length and breadth of the state. We know some of those patients were elderly, and we know some of them were there for days on end. We also know that they're only patients waiting to be admitted. Many more waiting for care were also waiting very long periods of time, and in fact were waiting over 24 hours, and in some cases days on end. Some of them ending up sleeping on the floor in emergency departments. That's what happened. So I want to, in the couple of minutes I have, Minister, focus on all of the solutions which I feel need to be implemented very urgently by your government. We know in the very short term, when we have a crisis and a surge like this, what we need to do. We have to prioritise care in emergency departments. We have to redeploy staff. We have to do all of the things that we know need to be done. That's crisis management. But we've known for some time that hospitals simply don't have the capacity that they need. So once and for all, we have to make a decision that we're going to put the beds into our public systems that we need to enable those decision makers on the floor of emergency departments to admit patients much quicker. So we need more beds. We also need more staff, more consultants, more doctors, nurses, healthcare assistants, radiographers, allied healthcare professionals. We need many more of them. We need more diagnostic capacity, and I've been saying that to you for some time. The lack of public diagnostic capacity in hospitals makes it more difficult for those decision makers to speed up the care for people in emergency departments, and that in part is the reason why people are waiting too long. All of that capacity is needed in our hospitals. We also need to expedite the elective-only hospitals and the surgical hubs that were promised to ensure that we have a separation of scheduled from unscheduled care. So capacity in acute care, including elective hospitals, plus putting capacity into our hospitals is the first priority. The second priority, Minister, has to be workforce planning. We have to substantially increase training places, and we have to ensure that we have sufficient recruitment and retention strategies and deal with all of the contractual issues, because we need to train more staff and we need to hire more staff to open the beds, to provide the diagnostic capacity and to put the physical infrastructure into the hospitals that we need. The third priority has to be right care, right place, right time. Sounds great. I heard you say it time and again. It's the cornerstone of Sláinte care. But again, we have people who should be cared for outside of hospitals, but the capacity isn't there. And I think what really angered people during the month of January so far and December was when hospitals were saying, don't come to emergency departments and avail of all of the alternative care pathways that are available, out of hours GP care, out of hours pharmacy care, only for many people to be ringing numbers, not getting through, not a chance of them being able to avail of any of those services because the capacity wasn't there. So we need more GP capacity, we need more out-of-hours capacity, we need more community intervention teams doing all the work that needs to be done. And the fourth priority, Minister, has to be reform. We need good management and we need good leadership. It has to be said that what is called organisational grip, which in layman's terms is simply good management, is absent from many of our hospitals, but we're not using the resources in the way that we should. We also have to expedite the regional health areas, get that part right where we integrate healthcare and not have the layers of management that we have, a single tier of management that can make decisions in relation to primary care, community care and acute care. We're not doing any of that. So I have to finish and say this to you directly, Minister. I believe that you failed as Minister for Health to properly support our health services. I think you should take responsibility for that, and I think you should apologise to all of those patients who are left without the care that they deserved, and you should apologise to all of those on the front line who are left high and dry without the tools and the capacity and the ability to deliver the safe care that they wanted to deliver.